Again, I'm hygiene for any procedure. Welcome to the patient's door. Hi there, how are you today?
Good, how are you?
I'm good. I'm John from UBCO, a second year nursing student. I just have a couple questions before we start. Is that okay?
Sure.
Just have your ID band. What's your full name?
Carl Smart,
Date of birth?
June 29, 1944.
Amazing. Just here to do a wound dressing, see how it's looking like, and make sure it's nice and clean. Have you done this before?
I have, yeah.
Amazing. Did you take any pain medications beforehand?
No, it's not bothering me.
Good. And do you need to go to the washroom as well?
Nope.
We're all okay. Good. I'll be right back and get all my supplies, okay? Amazing. Get a set of gloves. And clean table. These out of the way. Hygiene. Have my supplies ready. I got my saline bottle in this area. I got Nipor. And then my 2 sets of gloves. And then my dressing tray. I might need some extra gauze as well, so that should be here. Now I'm ready to open up my sterile dressing or kit. Hygiene. Have this open up, make sure you're touching only that 1-inch border. Same thing with this. Again, 1-inch area. Keep in mind maintaining that sterility. Put this on my hand. I'm going to use this to gather all my supplies. Have this towards this side. Got all my gauze in there. This extra one is on this side. And then get my metal forceps in again, only touching the end as well, and maintaining that sterility. I got garbage in this area as well. Again, I'm trying to get it away from my side, and then put this beside as well, keeping that 1-inch border. I've already got a garbage on this area, so no need to set these up. Don't want to kill the planet. Got this all down. I need another gauze though, so I want to put this and bring it down. Again, make sure it's high enough so to maintain that sterility. I'll touch this again, make sure that my gauze are nice in place in this area. And also have place for my sterile saline. So again, going from the sides to make sure 15 centimeters height. Again, that should be enough, and then away from it as well. And back in. Got all my supplies, maintaining that sterility, put a set of gloves on, and make sure that we take the old dressings away. Again, I've got our supplies right here. I'm just gonna check your wounds that you had and take that old dressing away, okay?
Sure.
So again, just the Nipor. Make sure that I'm doing it gently. Because again, we just want to prevent that skin breakdown that might happen. So again, take the old one out. Check, make sure if there's any drainage, what type of drainage and amount of drainage that it has. Again, no clear leak signs. Pull that away. Again, hand hygiene. Another set of gloves. Another set of gloves. And then I do have some absorbent pads that I will put down to make sure that we don't create a mess while doing this wound dressing. So again, have this area right here. Pick this up. Make sure only tips are down. And then only touching the border, and make sure that the shiny sides is down. Only that border that we have. Again. And do you mind lifting your hands for me? Yeah, so this will just absorb all that. Let's put it down. There we go. Again, so we've got everything. We can now do our dressing change. Just gonna put this, there we go. Make sure I got the right dexterity of the hand. Make sure you put this on the side. It's now to make the dumplings, 4 corners in. Nice and tug. Dip in our saline. Take the excess fluid out. And we're gonna start from the middle, proximal to distal right there. Put that down. Another one as well. I got 2 right here. Have it all prepared. Again, dumplings again. We want to do 5 of these. Again, have that excess fluid out, going from farthest away. Another one in. Tips down. Always got to remind yourself. Saline. Fluid out. Do this way as well. 2 more. 2 more just to make sure that it's nice and clean. Another one further away, out. Same thing in this area as well, under dumplings. And then the other as well. So once that's done, I'm now going to use some dry gauze. Make sure to dry the area. The one thing though is we only want to dry the surrounding skin and not the incision itself. So we still want to maintain that wetness in the area. So again, what I'll do is I'll go farthest away, down. Laser focus. I'm going to do 4 of these, 2 on each sides. Another one on that side. And last 2. After this, you can call me a dumpling master, I think. On this side. And we're doing, oh! That's stuck again. Make sure you watch that out. And these metal prongs or a scalpel can be very strong as well. Again, those are the last one. We maintained the incision nice and dry. Put this on the side. And after it's all clean, we have a better outlook or look of the wound to make sure we want to assess that. So that's the length of the wound, sutures, make sure it's the right amount. We are not missing anything. Around the skin, make sure that there's no inflammation, redness, or sign of infection, which in this case is a really good example of a nice, good, clean wound. I'm now gonna grab a set of Nipor that has actually been length and make sure it's a proper size. With these though, you don't want to touch the main adhesive pad, just that is the sterile part. And make sure you only touch the sides. Again, make sure you put this on top of the wound because again, we really have that narrow range of the pad and can be missed. Make sure it's nice and intact. We would like to put a date on it to make sure that it does get changed constantly, kind of prevents with the healing of the wound. We're now all done. We want to throw all these away. Make sure the scalpel, pretty sharp, goes to the sharp end. And we're done.